teaches.
12. Mom forgot you were 12. Okay, that's okay.
Welcome to the Holistic Kid Show. My name is Zane.
My name is Imaz. And my name is Qasim.
We're the Holistic Kid here to educate us kids from the inside out. Over the last 4.5 years, in the 180 episodes, we have given you guys a lot of information. And it can get overwhelming on where we kids need to start to help our brains, bodies, and specifically our hormones.
Now, add on top of that, what we learn on social media can really make us kids and teens really confused.
I mean, I started this podcast when I was 9. I really changed in front of your very eyes. I am 14 now, so I need my hormones to work for me, not against me.
Yeah, our mom says we teens and preteens are a ball of hormones.
What does that even mean? And what can we actually start daily to help us with our hormones? Because I don't want to deal with skin and other problems during puberty and life.
I mean, that is why we can't wait to talk to our next guest. Dr. Cassie Smith, MD, is a leading endocrinologist and the founder of Modern Endocrine. With dual board certifications in endocrinology, diabetes, metabolism, and internal medicine, Dr. Smith brings a wealth of enterprise and experience to her practice. She focuses on a 10-step system to repair cellular damage, balance hormones, and promote overall wellness through a holistic and preventive approach.
She also has a podcast episode called Back to Basics. That is why we needed her on this show. As a medical doctor and a podcast host, we need help with the basics.
So thank you so much for joining us today. We need your help, all of us teens and kids.
We are so thankful for your time and wisdom today.
Thank you for having me. That was a great introduction.
So how does a medical doctor, actually a medical endocrinologist, go from a conventional care model to what you were doing today?
We would love to know your story.
That's a great question. I think that what really prompted me to end up in the functional medicine space was that when I got out of school and I utilized everything I learned over 13 years of training, for 2 years, I took care of people and they didn't really get much better. In fact, they got worse. And so that was very disheartening when you do a lot of education and a lot of school with the hope that people are going to get better and you're going to make them feel better, and they didn't. And so when I was practicing that, what we call traditional medicine, where, we see people, we write them a prescription and we send them out the door, what I found was I saw them again in 3 months and they weren't getting better. And so I wanted to make people better, and I wanted to help them figure out ways to change their lives so that they didn't need to continue to take more medications. And so that's kind of how I ended up in this functional medicine space.
Wow, that is so inspirational. So
what are your 10 basics?
My 10 basics, that's a good question. So we start at Modern Endocrine with cell membrane health. So if you've gotten there in school yet, or you remember from just regular biology, cells are made, of membranes or kind of like layers that surround the cell. I tell my patients kind of like doors. When you go from one room to another room in your house, things in your body have to do that too. And they go through something called cell membranes. When your cell membranes aren't working well, then that's a huge problem. Hormones and nutrients and things your body needs, signals, they can't go from one room to the next room in your body. So imagine if you were stuck in your living room forever. You could never make it to the kitchen, or you could never make it to the bathroom, or you could never make it to your bedroom. Or if you did, it was just a very difficult task. You wouldn't be very sustainable. You wouldn't be very healthy. You wouldn't feel very well, right? Because you need food and you need sleep and you need nutrition. And so we really start with cell membrane health at Modern Endocrine because we feel like that's where everything starts. The second thing that we look at is gut health. And I know you guys talk a lot about nutrition and you're very versed in that. But if your gut health is not where it needs to be, if your gut's not healthy and you can't absorb the nutrients that you're eating from your food, then you end up with a lot of problems. And so we really focus on gut health as kind of our second pillar, because a lot of people struggle with GI issues. You know, with you guys in particular, since you talk to a lot of kids, a lot of teenagers struggle with acne, right? So 53% of people with acne, especially teenagers, it comes from your gut. So it comes from something that you're eating or something that's wrong with your gut. And so we focus on gut as our second approach because there's a lot of things that you can do from a gut perspective to kind of help everything else, if that makes sense. And then after that, we focus on hormone health, right? So we focus on making sure that all of your hormones are balanced. We look at those. Then we move on to nutrition. So we think that nutrition is very important. And by that, we talk about micronutrients. So all the different things that you need from food and making sure those are balanced. We talk about exercise because exercise is super important as well. So like exercise and movement, things like that. We talk about light therapy with our patients. So making sure you're going outside and seeing the light, making sure you have the right type of light during the right time of the day. So you don't want a lot of blue light, really bright lights when you're trying to go to sleep. So a lot of kids now are playing on their phones super late at night, right? Or watching TV. And then they lay down and they think, well, why can't I go to sleep? Well, because your brain is stimulated by the wrong type of light. So we talk to our patients about light therapy. We talk to them about stress. We talk to them about relationships, about sleep, which is another really important thing as well. So we kind of talk about all these different things. We kind of layer them at Modern Endocrine, but we take this approach of not only just looking from a health perspective and a lab perspective, but also a lot of the things that you can do from a lifestyle perspective as well, if that makes sense.
Well, that makes a lot of sense, especially because a lot of the things that you said, we really do talk a lot about in this podcast. The only thing is that this podcast, we're talking more about hormones. And it's really cool to see all of these things that we need to do. They can also really affect our hormones. So that's really amazing.
Yeah. Yeah. A lot of your gut, I was telling your mom prior to starting this, a lot of your gut and hormones are very interconnected. So I have a book that's going to come out later this year, and all we discuss are how your hormones and your gut are related, because I think it's important for people to know that, right? Like some people think, oh, well, I have, this symptom of bloating, or I have this symptom of acne, or I have this symptom of, my stomach hurts, or I can't go to the bathroom, I'm constipated. It just has to be something I'm eating. Well, sometimes it can actually be a hormone imbalance as well. So our hormones affect our gut and our gut affects our hormones. So it's really important for people to understand that. And that's kind of where everything starts, right? You have to do all the other things as well. But the quote I like to say is, even though you're eating, like, you shouldn't be wasting money. Don't waste your money on organic food, right? It doesn't matter if you're eating all the different organic foods if you're not doing the basics, right? So if you're not going outside and playing, if you're not going outside and seeing the sun, if you're not getting off your phones and not having as much screen time, if you're not getting good sleep, I feel like that's another thing that adults and children struggle with, right? We really need to be getting, as adults, 7 to 9 hours. As kids, anywhere from 9 to 12 hours, depending on how old you are, right? We've got to make sure we're getting rest, and it has to be good rest. If you're not getting that, then your brains aren't able to clean themselves. You're not able to make hormones for the next day. And so it's really going to affect how you act, feel, and eat the next day. It's going to affect your learning, your mood, lots of different things. So sleep's another really important thing. And so you've got to be doing all these foundational things, eating right, sleeping right, exercising, before you really even worry about eating organic food and things like that.
Wow. So what are hormones imbalances? Why are hormones imbalances on the rise?
That's a really good question. I think that question kind of goes back to what we're talking to about, like, lifestyle in general, right? So you guys might be too young to remember this, but I know your parents are. When I was a kid, we went outside and played a lot. There wasn't a lot of TV. There wasn't this Hulu, the streaming, iPhones, all of these things. And so I think what's happened with society is we've become just so, just our expectations are different, right? So like we're on social media all the time, seeing all these things. And so we think that we should be doing way more than we're doing. Everything should be like just better than it is. We're always just kind of expecting more out of ourselves. And so I think stress levels have gone up just because you see somebody on social media doing something, or you see somebody playing a certain game, you want to play it. I think that we have deprioritized sleep in this country. So there's so many things to watch on TV. There's so many games to play. There's so much stuff to do on your iPhone that, I would rather do this instead of go to sleep. I think that we've deprioritized family time, right? So a lot of families, that are listening to this, and kids, like when I was growing up, and you guys probably do because you have a wonderful mom, but when I was growing up, we ate dinner at a dinner table every single night as a family. It was not negotiable. You were there at 6:30 for dinner, or you were in big trouble. Things like that have just changed, where we're eating dinner in cars and we're eating dinner on the way to practice, and so just a lot of the key things you need to be healthy, relationships, good nutritious food, being outside playing, getting good sleep. A lot of these things have just changed because society's expectations and norms have changed. And then on top of that, our food system is different than it used to be when I was a kid. We're having to feed more people. There's more toxic dyes and fillers in our food, more sugar additives. And so just the way we're eating as well is changing. So we're eating differently, which is causing change in our gut, like our gut microbiome, the bugs that live in our gut and the lining of our gut. And then there are also the stress and the different things, the fact that we're stressed, we're not sleeping as much, we don't have as good relationships, we're not seeing the sun, all that affects your hormones as well. And so those things together, I think, are just causing a lot of hormone havoc, a lot of inflammation, which then makes your hormones not work even, so it changes how they work just from the inflammation. And so there's a lot of reasons why I think hormones are different, but those are the main things. It's just life's just different than it was 20 years ago.
Yeah, I mean, the world definitely did change, especially with this big technology revolution. Yeah, a lot of kids don't really talk to their parents as much. They're more on their screens away, which is really not good. They should really get back to, yeah, it's really good that you were talking to your family at lunch. That's really, like for dinner. So.
Yeah, and I know a lot of people, like a lot of kids listening to this might be difficult for you to understand, but like when I was a kid, we didn't have cell phones, like not at all. Zero. There weren't cell phones when I was a kid. Maybe like the flip ones that you could like dial a phone number, but there wasn't this like texting phone thing. And I can actually remember as a kid, we had a computer, but it was an analog computer. And so you guys probably don't understand analog. A lot of people don't, you may, but analog means like there weren't these pretty pictures on a computer like we have now. It was like a black screen with like numbers or like something you could type out, but it was different because we didn't have those things. So, and there weren't as many TV things to choose from. And just, there's so much streaming TV now. So when, 20 years ago, kids would go outside and play, or they would play with each other because that's what they had to do. And to your point, I think that's a huge, like something that needs to be thought about and brought up. Kids don't talk to their family anymore. They don't even hardly talk to their own friends. Like I was sitting somewhere the other day and these kids, they were brother and sister at the airport. They were texting each other, sitting right next to each other. Like, have you guys ever done that? Just sitting there texting each other, texting each other. Okay, good. But like, you need to, you guys should talk to each other and talk to your parents and, instead of being on phones, for sure.
Mm-hmm.
Yeah, like when if someone this is what they usually, I think they probably would do, like instead of if someone has a phone, instead of going down and going to their parents, they're like, there's a phone right there, I'm gonna go to the phone.
Yeah. And I get it because it's interesting, right? It's entertaining. So I know all the phone apps and the TV shows and stuff, they keep your attention. They know that, if they keep feeding you different things that are fun to look at, then you're going to want to do that. But there's also all these other things, light and different things like that. And the thing I worry about is kids, I want you guys to learn how to communicate with other people really well too, right? So if you're not practicing having these conversations with people and practicing being in sometimes difficult conversations or conversations that might make you feel a little uncomfortable, then when you get older and you go get a job and you're just expected to have these conversations, it's going to be really hard because you were supposed to practice when you were a kid, when, it's like you can't really get in trouble. You can't really say the wrong thing. You're learning. Your parents are supposed to help you learn how to interact with situations and different things. And when you have feelings, help you figure out, why am I having this feeling? Why was that hard? What do I need to do to make it better? And I worry that kids today aren't going to get a lot of that interaction. And then they're going to get put out into the world when they're 18, in like 4 years for you. And you're going to be put in these situations where you have to have these difficult conversations or difficult interactions. And it might be harder if you don't have the practice from when you were a kid, right?
Yeah.
Yeah.
Yeah, right?
Yeah,
not
well,
fair. That's not fair to you,
yeah.
right?
I mean,
Yeah.
in our school, they banned cell phones. So like when you walk into the classroom, you need to put it inside a pocket where the teacher can see. So it's right there and it's very far away from all the desks. And I think this is a good approach because the kids could still like have their phones, but like they can really focus on their schoolwork and talking. And I think it's a really interesting idea, and I think it's a really good idea. And more schools should really think about banning phones from their classrooms.
Yeah. Do you guys still have recess? Do you call it recess or like PE?
Yeah.
Or?
I have recess.
Only in elementary school.
Yeah, in middle school they get rid of it, which is like, and they just give you more lunch. But the thing is, like, most of the time,
Yeah, like
Our lunch is the exact same.
no, our lunch is
no,
like
our
25
lunch
minutes.
is
Ours
like,
is 30 minutes, 25 minutes too.
oh,
And
well, they just
25
ripped
and
us
30
off that
minutes
one.
of recess.
Yeah, I think like also teens should also be able to also go in recess.
For sure. Yes. Because having fun is part of life, right? Like, yeah, they should be teaching you that you should be having these fun experiences with your friends and taking a little break during the day and having fun. So that's sad. I didn't know that you don't get recess anymore. But I guess if I think about it, I didn't get recess per se in high school either, which is strange. Yeah. I think it stopped after middle school. So
For us, I mean, I'm in middle school and I don't get recess, and they kind of like just scam us off. They give us more lunch, but in the lunch they keep you inside, and now you're forced to eat unhealthy food. Well, you can bring your Chromebooks, and a lot of people say that they do work, but they don't actually do work. They just play games on their Chromebook.
So you're allowed to have your computer at lunch?
Yeah.
Oh, wow.
So eating at lunch, you're
allowed to do homework on your computer.
Okay.
It's not really a rule, so
That's interesting. What are some of the do you guys have any question, like are you having any sort of like hormonal issues or hormonal like questions as like a teenager? Have you had any issues with like acne or anything like that?
Well, I'm a little confused, like with the skin and especially like pimples and everything. How do you what foods are really good for dealing with skin health? Yeah, so like what foods are really good for skin health?
That's a great question. So skin is really difficult, right? Especially acne, especially when you're a teenager, because you have all these changing hormones. And so it's hard when you start to develop acne. Is it just normal because your hormones are changing? Is it something that you're eating? And so the thing you have to remember about acne, there's a couple of things. There are bacteria that live on your skin, right? We have bacteria that live everywhere on our skin and our stomach that are supposed to be beneficial. Sometimes that bacteria on your skin can get out of balance because as your hormones change as a kid, as you get more testosterone, you're going to have different bacteria that grow on your face, or you're going to sweat more, right? So you may notice as you get older as a kid and you're doing physical activity or doing things that make you sweat, you're going to smell different and you're going to sweat more. And when that happens, that some of that is more bacteria or different bacteria on your skin. And there are certain bacteria that make you more prone to acne. So it is important as your hormones are changing, you're doing physical activity, things like that as a kid. When your mom or somebody tells you, you need to wash your face twice a day, you need to wash your face twice a day. Like you got to take a shower and you got to wash your face. It's not because we're being mean, but it's because we got to get all that bad bacteria off that happens when you sweat. We want you to sweat, but sweating is a way that your body detoxifies bad stuff, right? So we all have toxins in our body and we get rid of it by sweating. And so sometimes when we sweat, some of that bad stuff comes out and it changes the bacteria on our skin and we can end up with acne. So that's one of the reasons why as kids, kind of their hormones change, a lot of them will get more acne. Some people will get more acne, though, to your point, because of the food that they eat. And actually, 53% of kids with acne, like I said, it can be dietary related. And we think that most of that is dairy consumption, unfortunately, or fortunately. And so it's because dairy is very inflammatory to your gut. And so when you eat a lot of dairy, it can cause inflammation in your gut. Not in everyone, but in people who are already have an inflamed gut. So let's say somebody who's maybe not getting enough sleep, or somebody who's eating a lot of sugar, or somebody who doesn't get outside a lot, is very sedentary, has maybe gained some weight, their gut's already inflamed. Then you add dairy and it makes it worse. So if you're struggling with acne, especially as a kid, make sure, of course, that you're washing your face, and then if you're having a lot of issues, I would say avoiding dairy is one of the easy things that you can do, and just do it for 2 weeks and you're going to notice whether it helps or not. The other thing as a kid that you can do if you're having a lot of acne is think about what you drink and eat as far as sugar. So I know sugar tastes good, right? And I know that being a kid, it really stinks because the food that you shouldn't eat, they target you on purpose with ads, right? They make really fun looking food, really fun colored food, really fun, pretty colored gummy bears and M&Ms. But when you're eating a lot of food that has sugar, it's going to cause issues with your gut, and then that's going to cause issues with your skin. So I would say a couple of other things you can do is try to avoid sugar, lots of candy, and just make sure you're having a good balanced diet, right? Try to eat some things that are good for your gut. The bacteria in your gut are hungry and they eat things like yogurt, like sauerkraut, like, things like that, vegetables. So lots of fibrous things. So things like oatmeal. And just so trying to make sure that you're eating a balance of things. You can eat things like vegetables and fruit. Trying to make sure you're eating like a full color of foods is beneficial too. Like pick something red, pick something blue, pick something green, throughout the day. So I think that's a lot of the issues that kids have as far as acne is just they have such a disposal of sugared beverages, sugared food, things like that. And so trying to avoid those for the most part and eating, vegetables, fruits, things like that.
So what are the basics for us kids to optimize our hormones balance?
So that's a good question. Again, I think for kids with hormones, one of the huge things you can do is make sure you're getting adequate sleep. Because when you sleep, your brain kind of cleans itself out and helps clean your body out. And it's going to help make hormones for the next day. When you're a kid, what's really important is growth hormone and IGF-1. And your brain kind of makes these while you're sleeping overnight. And so if you're not getting good amounts of sleep and allowing your brain to kind of clean out all the toxins from the day before, and when you go to bed at night, actually, that's how you really learn. So whatever you're learning at school, whatever you're trying to put together, whatever the teacher's teaching you and you're reading, it's kind of there, but it hasn't like imprinted itself yet. It's kind of floating around, just like bouncing around. When you go to sleep at night and you fall asleep and you're really asleep, you have a system in your brain that comes out. It's kind of like a trash system. It's called your glymphatic system. It comes out, it's like a street sweeper, and it goes through your brain and it sweeps out all the bad stuff that's in there if you have any toxins or inflammation. But then it also helps your brain start making all these connections from what you learned the day before, right? So it's going to help you solidify all those things that you learned so that when you wake up the next day, you're like, oh, I can actually remember that. But also your body's making hormones while you're sleeping so that you grow, so that you can, feel good the next day, so that you're not craving bad food all day, so that your mood isn't bad, so that you're not tired. So I think as far as hormones go from kids, really making sure that you're going to bed at a really good time. Most kids need to be in bed by 9, I would say. And depending how old you are, maybe even earlier than that. And you want to make sure that you're getting a good amount of sleep. So that's one thing you can do that's really easy. The other thing is making sure that you're moving around and getting some exercise. And that doesn't mean, whatever if you want to go outside and play, if you want to ride your bike, but you need to be doing something outside in the sun for at least an hour a day. It doesn't have to be all at once. Maybe you go some in the morning, or you go, you have recess, you go after school, you go after dinner, but you really need to be doing some movement too, because that also helps your hormones and helps your brain, helps your muscles, things like that. And then obviously eating well, right? So we talked about that. I think those are the big things with kids is movement, what they're actually eating, and sleep. Like if you can do those 3 things every day, pretty simple things, then you're going to make it a long way in life and be pretty healthy. And those are good habits to get into too, right?
Yeah, those are really good habits. And as I said, again, those are like things that you'll always hear. If you ever want to learn about brain health, if you ever want to learn about like any type of health, of those, especially those 3 are super important. What you eat, how you move, and when you sleep are really important.
Yeah. And like also I think it's orange foods that also help your skin with alpha and beta carotene.
Yep, they do.
So it's also like eat the rainbow, eat colorful.
Mm-hmm.
Yeah.
So what is one tip that you could give every kid, like one thing that you could give every kid that they need to, and teens, kids, teens, and that they need to do right now or today?
One thing that every kid needs to do today. Oh my gosh. I would say if it's just one, then my advice to you would be to decrease your screen time. And that includes computers, phones, TVs, like however much screen time you're doing. Let's say going forward, starting today, we're going to do 30 minutes less. And with that 30 minutes, I want you to go outside. I want you to be outside in the sun, playing, doing whatever. I don't care if you just sit there and play with the grass, but go outside instead of being on that screen. I think that would be my number one thing that kids could do. Ideally, you go outside and you play with somebody else. You communicate with another human, another kid, your parent, take your dog, but go outside and play.
Wow, that is amazing. And for the people who want to continue listening to you, where can people learn more about you and your amazing work?
So I have an Instagram page and a Facebook, TikTok page, YouTube channel. All of it is Modern Endocrine. I have a podcast. I think you guys talked about it, Back to the Basics. It's actually being rebranded on Sunday. So it's going to be called Hormones, Metabolism, and You. But my podcast, so I have a podcast, I have social media. We have a website, modernendocrine.com, but those are all the places.
So thank you again, Dr. Smith. This was an amazing. And powerful episode.
Amazing.
Yeah, thank you so much for having me.
So now let's recap Dr. Smith's key points.
Stress, lack, or sleep. Not great relationships can lead to inflammation and hormone havoc. Life is just different than it was 20 years ago.
We kids are changing our brains, body, and hormones. So it is important. They're all changing. So it's really important to take care of ourselves. Getting back to the basics is the key to working on our hormones. Work on the cell membrane health, gut health, hormone health, nutrition like micronutrients, exercise, light therapy, sleep, relationships.
And stress. If I didn't say stress, that was my fault. And stress.
And stress.
Limiting stress. But I think you guys nailed it. Yeah, those are all great takeaways.
So there are also so many things that we could do with our lifestyle.
Don't waste money on organic food. If you aren't doing the basics like getting enough sleep, light, and nature,
then what's the point? So make sure you have enough sleep. If you aren't getting enough rest, that will affect your choices the next day. Your brain is cleaning itself and growing and making connections that you learn.
Your symptoms and hormones are related to your gut. Your gut affects your hormones, and your hormones affect your gut. The food you can eat can affect your gut and can affect your skin. Avoid sugar and candy. Eat foods like sauerkraut, vegetables, and fiber. Eat more color to help your gut, skin, and hormones.
Get outside and move. Try to get at least 1 hour of sunlight throughout all the days. Decrease your screen time today.
And thank you. And thank you everyone for tuning in. Until next time, I'm Zansari.
I'm Imad.
And I'm Qasim.
Follow my family on social media, Holistic Mom D, and look out for our book releasing September 2025 called The Teen Health Revolution. Kids need to learn from other kids. Please download our podcast on iTunes and leave reviews so other kids and families can benefit. We need to create a healthy future for all of us and the planet. Join us next week for another episode of the Holistic Kid Show, where kids are empowering kids.
Thank you,
everyone.
Thanks for having